Hello, my name is Moshe Heller, and I've been practicing and teaching Chinese medicine for the past 28 years. And I wanted to first thank the American Acupuncture Council for organizing this show and giving me an opportunity to speak about this really important subject matter, treating children with anxiety. So, if you can start the slides. So we're going to talk in the next 30 minutes about treating children with anxiety, and it's definitely a growing uh, issue that I see more and more in my office, especially lately and since the pandemic. And I think the pandemic definitely has a strong influence on children's tendency to be anxious. And and we can see this very clearly in even in the CDC report from March through October. The proportion of mental health related emergency department visits increased 24% in children aged 5 to 11, and 31% among teenagers aged 12 to 17 compared to 2019. So there's a huge increase. And but I wanted to present how we can really help with Chinese medicine, with our medicine, very much. So I wanted to. I'm going to start by just going over a case study that will present some of the common issues that I see in my office. So I want to talk about Sally, which is not the, it's a not her real name, is a 17-year-old female that came to see me in the office, and she was brought in by her. She came in with her mother, and then as she walked in the room, I noticed that she had a really pale complexion, and with that, her eyes were very bright. Although we didn't, she didn't have a direct gaze at the beginning. There was a lot of shyness. Her body was very thin, but looked very tense. And her main complaints were having anxiety and digestive disorders like indigestion. She felt a lot of gas and bloating and very uncomfortable with her in her digestive system. As I said, she came with her mother, and she was at first very shy, and her mother would actually answer her questions. But after a while, she opened up, and we even I asked the mother to wait outside, so we had some time together to talk about her issues. So she reported that the anxiety really started a little over a year ago, and that was, about a year into the pandemic. And she thought it was related to the changes due to the pandemic. So the pandemic created a lot of change in children's lifestyle and the way that they had to learn, and that caused, of course, a lot of stress and therefore anxiety. So, in the past 3 months, though, her symptoms became much more severe. And they included things like difficulty falling asleep, palpitations, nightmares, difficulty focusing on schoolwork, and being easily distracted, racing thoughts, and then loss of appetite, and then also a tingling and loss of sensation in the fingers, fingertips, and toes, which is very typical of some of the panic disorders, and also had some diarrhea, like on and off diarrhea, and a pasty feeling in her mouth, and nausea, frequent nausea. So these are all the symptoms she reported. So she also experienced on the background some seasonal allergies. So she had that tendency to have some damp or phlegm, frequent headaches, mostly occipital and frontal, and tension in the neck and shoulders was very. She experienced that frequently. She also complained of having a weak digestive system even before, meaning that she would be very gassy and experiencing soft stools and diarrhea frequently. She craved sugar and was taking an iron supplement because of a low iron count in the blood. Her menses were regular. They came every 28 to 30 days, but there was a lot of heavy bleeding and it lasted 4 to 5 days, and had some low back pain prior to the arrival of the bleeding. And her pulse was really thin and tight, and the tongue very swollen and puffy, and there were teeth marks and a thick white coat on the all over the tongue, but the tip was very red. So I diagnosed her with having a spleen and heart vacuity, which is a common pattern that I see in adolescents. And the blood vacuity and liver qi, also having some blood vacuity and liver qi constraint with a slight damp accumulation or a tendency to have some dampness. So I chose to include points like Heart 7, Ren 17, Ren 12, Ren 6, stomach 25, stomach 36, and spleen 6. So I would choose anywhere between four, 4 to 6 points, and you do that bilaterally, and would see her once a week. So we talked about changing her diet, eliminating dank producing foods, meaning that reducing her dairy, cheese intake, and simple carbs like white flour products, and um, and and eating more foods that strengthen spleen, chi, and blood, things like beets and yams and butternut squash, um, to include it in her diet so that there'll be some nourishment, as well as um, maintaining a warm diet, meaning eating more soups and cooked foods rather than raw foods. So we could see here that there's that I sort of arranged all the symptomology and how each with each of the which each of the patterns, the loss of appetite and the gassiness and the sugar cravings and weak digestion and tendency for soft stools all indicated a spleen vacuity. The heart vacuity was manifested with the palpitations, the nightmares, the difficulty focusing on schoolwork, and being easily distracted. And the blood vacuity with the difficulty falling asleep, which is something I differentiate. Difficulty falling asleep is more of a blood vacuity as opposed to falling asleep easily and waking up in the middle of the night, which is a more of a yin vacuity. Um, then the heavy menses may also contribute to the blood vacuity. So we are seeing these heavy menses. It may also indicate that. The liver qi constraint we see with this, the frequent headaches. She also the tense look, the tense neck and shoulder, and this kind of tendency to be easily stressed. Um, and this combination of having liver qi stagnation with blood vacuity, which points towards a liver blood vacuity, would kind of explain this kind of tendency to have loss and tingling sensation at the toes and fingers. And the seasonal allergies, of course, may kind of point to a bit of a lung deficiency, as well as maybe some tendency to have dampness, as we say, and also the tendency to have nausea and this kind of pasty feeling in the mouth, all point towards dampness. So I think I skipped a. Okay. So I actually prescribed a herbal formula, and I prescribed a formula called Calm Plus. This is a formula that I created in my herbal company called Motion Herbs, and I have a link down at the end of the slideshow to our website, motionherbs.com. And this Plus is a combination of herbs that move liver qi, calm the heart, and and strengthen the blood and yin. And therefore, I use that. I like to use this formula for anxiety, and it's really fit very well into this picture. Um, uh, and so uh, after 10 days of this formula, she reported feeling much calmer. She did not have any anxiety episodes in the last few days, and she felt much better. And sleep pattern was also um, uh, much better, and she was able to do schoolwork with less effort. So she showed marked improvement with taking this formula. After 3 months of this formula, most of her symptoms were resolved, and including her digestive issues, and we decided to stop taking the formula. So after 3 months of this formula, she reported that her symptoms were completely resolved. So I wanted to go over. I'm actually just going to skim quickly about the definition of anxiety in biomedicine, in the sense that we want to understand how when people say that they're anxious, what does that mean? So usually anxiety falls under what we call generalized anxiety disorder, and you can read this. Hopefully, um, this PowerPoint would be available for you to go back, and there are under the anxiety section, we also see panic disorders as part of that, as well as things that are associated with anxiety is phobias and different specific phobias included in that. And also social anxiety disorders and separation anxiety disorders, and post-traumatic stress disorder is a very common diagnosis nowadays, and it is very important that we understand that when somebody complains of having anxiety, it could be related to post-traumatic PTSD. In terms of Chinese medicine, on the other hand, it's interesting that anxiety is not really a classical category that is used in classical Chinese medicine, but is more a modern term. And since we see palpitations as being one of the very common symptoms with anxiety, it is a lot of times included in it. So fear and palpitation, Jingji, or panic throbbing, that's Cheng, or Zhangzhao, which is agitation. It's this kind of feeling of being overwhelmed. Oh, I'm sorry. I think okay. So, but in children, that is really we have to remember a few things that are very important, I think, when we're treating children with anxiety, because children have unique characteristics that make them more prone to having anxiety. First of all, there's this famous saying that says that all children disease are caused by fear, fright, and indigestion, and that starts from an early age. So most of the pathologies that we see in children stem from having some kind of a fright or fear or being anxious, and then also in combination with indigestion. These are the two important aspects. So we also have to remember that it is the characteristics of children to be excess in wood and fire and deficient in earth, metal, and water. So that means that this kind of excess in wood and fire will create a higher tendency to be very anxious and very uh, uh, stressed, or they would pick up stress more easily. Whereas the metal, whereas the earth being deficient is causing a spleen vacuity, which will, although we think a lot of times as a spleen vacuity being and not necessarily associating with anxiety, in reality, I see that a lot of times this kind of earth vacuity is the cause for anxiety because of its relationship with the heart in particular. So it also is important to see that in each developmental stage, each age, we see different pathologies, common pathologies. And I wanted to point out that this age from 7 to puberty is the age where we are becoming more aware of our emotions and being challenged, especially by society, to control those emotions. And in that period of time, that is a very um, a time where we need to pay attention, because children can easily develop anxiousness around different issues because of that necessity to be in control, or this transformation where suddenly they have to be in control of their emotions. So a very, as we say, a very livery time at that, as at that period of time. So we have to remember that children are susceptible to emotional stress, and I'm talking about little kids, 2 years old, a year old, a few months old, four, or even later. Even the stress doesn't necessarily need to come from themselves, but rather from the environment. So they pick up stress and what's happening from their mother or from their caregiver or from their family or the surrounding. And I always believe that children are this, like this emotional antenna, so they pick up whatever is in the environment and it affects their own chi. So in that case, I always remember that when children come in with anxiety, I always check in with the caregiver, in from this idea of treating the child, treating the mother to treat the child. So especially with anxiety, that is very, very important to consider. I in our course in Jing Shen pediatrics, we also teach this whole idea that there is this kind of spiral of development, and we revisit different issues at each period of time. And so we really believe that this developmental mandala will tell you how to approach children at different ages according to where they are in this cycle of growth. And so we see here that each cycle of growth is related to an element, and that uh, and since it is controlled by a certain element, it has the same kind of nature that we would expect from that element in in that period of time. So attention, alienation, and anxiety are sort of a modern pandemic. We see that very commonly, and we see that because I think we are giving children too little, too late of these things, and things like too little connection, too little exercise, too little darkness, too little quiet, too little being bored. So children don't know or don't want to be bored, and I think that's actually an important aspect of growing up. But we also give them too much too fast, too much food additives, and energy-rich, nutrient-poor diet, too much pollution, too much artificial light and screen time. All these things create an excess of young, whereas not enough of a balance. And so it and so the um, so that it creates this kind of um, imbalance of having too much of the fire, and the chi then scatters, and therefore eventually will cause, it gives a tendency to form anxiousness. So I wanted to also point out that there are a few common patterns of illness that I see very frequently, that you can pick up, and they a lot of times will will cause development, or be part of it will be that the child will be anxious. So the first one has to do with what we call an accumulation disorder, and we see that frequently in younger children, although I think we can see a lot of times the remnants of that later on in age. But it's one of the advantages of treating children, treating pediatrics, is that you can catch these things very early on, and really prevent years of suffering later on, emotional suffering or physical suffering. So if you catch that on when a child is young, and you see that they have a lot of red cheek and a lot of irritability and insomnia, but also have this kind of indigestion or difficulty digesting foods, and you might suspect um, uh, an accumulation disorder. And by the way, accumulation disorder is a term that was coined by Julian Scott, which he has great ideas, and I found it to be very, very true and effective. But we go very deeply into assessing and diagnosing accumulation disorders in children in our course at Jinshen Pediatrics. And that this accumulation disorder also points to this kind of very important triangle, or three aspects that are connected and interrelated, and that is the neurogastroimmune uh, um, uh, triad, or trio. So there's a relationship between our nervous system through the vagus nerve that affects our gastrointestinal function, and that affects our immune function. And there is feedback in both directions, that we need to understand that it's all connected. So when we have an issue with our nervous system, like having anxiety, we definitely need to be in tune with what's going with the gastroimmune function. So accumulation disorders are a gastric disturbance that we need to look at, and we'll talk about the immune aspect in a second. So I just put in some main points that we use for treatment. CFANG is the main points when the child is young, up to probably 2 years of age. Later on, we might use more body points for treating that accumulation disorder. Hyperactive spleen Qi deficiency is another diagnosis that we commonly see. This is a child that has all the signs of spleen vacuity, but behaviorally is really having a lot, tends to be very anxious, has a lot of sleep disturbances, have a lot of sleep difficulty falling asleep, enjoying being the center of attention, and wants to be very manipulative. All these symptoms, and usually the child looks very thin and weak, but the energy is bursting. So hyperactive spleen Qi deficiency, another pattern that we commonly diagnose and or see frequently, um, especially associated with anxiety later on in life. Um, the interesting thing is that when we have hyperactive spleen Qi deficiency, our treatment is based on strengthening the spleen and not necessarily calming all that excess. It will come from this seemingly a false excess comes from a deficiency, and we need to strengthen rather than disperse. There's another pattern that we usually see, which is called hyperactive kidney Qi deficiency. This also will have a lot of spleen Qi deficiency signs and symptoms, but they'll have very specific other symptoms like dark pools around the eyes. The patient would be very thin but long. Face would be really pale, bright white, and be very, very fearful and anxious. In this case, the fear is very strong and having a lot of anxiety about different things. Being very hypersensitive, and also has a lot of issues around sleep, and takes very long to go get into bed. These are very difficult children to treat because they are so afraid from any thing that is done to them that they can become very hysterical. In any case, the important thing is that the treatment is again, um, mostly use points that strengthen both kidney and spleen, and not necessarily any dispersing treatment. And the last one, which is the other arm of the triple the triangle, which is the immune part, is the lingering pathogenic factor. And I think this is a very important thing to remember, because when we look at pathogenic factors that enter into the body when the child is young, they can become lingering, and there's a lot of signs and symptoms that will help you diagnose them. And once they are lingering, they can affect our emotional Qi, our the level of our nervous system, and therefore can cause anxiety later on, or a tendency to be very anxious. Um, we're running out of time, so I'm going to run through the rest of the slides. The treatment for the lingering pathogenic factors. We have this really amazing treatment protocol, which is BILAO, UB13, 18, and 20. And I use a combination of Xiao Chai Hu Tang or some kind of variation of Xiao Chai Hu Tang to treat that lingering pathogenic factor aspect of the patient. So in pediatrics, I just wanted to point out we have different treatment modalities. I'll tend to use a lot of Twina. Shonishin technique is an amazing, amazing technique, which we teach again at the Jingshan Pediatrics course. Um, uh, so I think that it's an amazing technique that we can apply to children and get very good results without inserting needles. And that negates the fear factor, especially for anxious kids. And I also use another technique, which is cutaneous electrostimulation, meaning using electrostimulation to stimulate certain points as opposed to using needles. All that is taught in our course. Um, we also connect. We use magnets, and we teach how to use them for for pediatric patients. And they're an amazing tool that you can actually send patients with it and show them how to massage it and participate in the treatment, and it creates great results. So I've sort of concluded some of the points that I use for anxiety, as well as common patterns in terms of using both points and herbs. And I'm actually running out of time, so I will end with this with thank you for being here and listening. And if you want to hear more, there's many avenues to hear more and learn more about treating children and with anxiety, or treating children in general, through either our my herbal company, which is called Motion Herbs, which I have sometimes free webinars on through that venue. I'm going to be teaching a course through Global Branches, which is called The First Cycle of Life, and focusing on the first years, 8 years of children. So you can uh, look at Global Branches, look it up online, and you can register on their page, and through our Jingshan Pediatrics course, which will be distributed through Net of Knowledge and Las OMS, and you can pick it up there. So I want to thank the AAC again for this wonderful opportunity to speak. It's been a pleasure. And I want to remind you that next Wednesday, log on to hear Sam Collins. Thank you very much.